Okay, let's unpack this. Picture this scene. You're relaxing at home, everything feels normal, and then out of nowhere, your dog, the one who usually sticks to you like glue, suddenly growls, maybe snaps, or even tries to bite a family member.
Hmm.
That feeling of confusion, maybe even a jolt of fear, if that rings a bell, you're definitely not alone, and what you're searching for probably goes way beyond a quick internet search.
It's truly remarkable how often we hear about this um, aggression in dogs directed towards the very people they live with, the people they supposedly know best. Today, we're going to take a real deep dive into understanding this complex behavior.
Exactly. For this exploration, we're looking closely at some expert information from a source we have here called Pasted Text, which specifically focuses on this challenging issue of aggression towards familiar people in our canine companions.
Hmm.
Think of this as sort of your direct route to grasping the underlying factors at play here.
Right. And our goal is really to extract the crucial insights from this material. We want to help you decipher the potential triggers, recognize those early, often subtle warnings, and really understand the key aspects of why a dog might behave aggressively towards those closest to them.
So let's get right to it. When we talk about aggression toward familiar people, what exactly does that encompass? What are we defining here?
Well, at its core, we're talking about aggressive behaviors aimed at individuals within the dog's immediate household or, those with whom the dog has an established relationship. The information we have suggests this often surfaces in situations involving resources.
Resources. Okay, but that's more than just the food bowl and a favorite squeaky toy, right? It sounds like it can be quite broad.
Absolutely, yeah. While many things can trigger aggression, what we often see as the core drivers are things like underlying anxiety and maybe the dog's perception of a threat to something they value.
Something they value.
Yeah, be it food, a favorite resting spot, or even a particular person. The text mentions several potential motivations that can feed into this. What some might call status or um, dominance dynamics, general tension or conflict within the home, maybe a dog's impulsive reactions,
Impulsivity.
competition for something desirable, or just a strong sense of possessiveness over something.
Okay, so it's less about this like inherent need to be in charge, which I think is a common assumption people make.
That's often an oversimplification, yeah.
Let's really dig into the why behind this then. What's going on internally or maybe externally that could lead to this kind of aggression?
Well, if we connect this to the bigger picture, the source indicates that underlying anxiety or maybe a general tendency towards impulsive behavior can certainly be contributing factors.
Okay.
It's also really important to remember that behaviors like, say, fiercely guarding a high-value chew or reacting defensively to something perceived as threatening even a familiar person's touch can be, in certain contexts, normal canine responses.
Right, right. A dog with a juicy bone growling if you reach for it isn't automatically like a sign of a deeply aggressive dog across the board.
Exactly.
So where does that normal guarding instinct kind of cross the line into becoming a problematic behavior?
That's where the interplay of genetics, the environment the dog lives in, and what it has learned really come into play. The text points out that looking at the family trees of dogs who exhibit this type of aggression shows a higher likelihood in related individuals,
Oh.
which suggests a genetic component.
Hmm.
There's even a possible link mentioned to difficulties with impulse control in certain breeds. Specifically, English Springer and English Cocker Spaniels are noted.
Interesting.
And interestingly, potentially more often in dogs bred for show compared to those bred for field work.
Wow. Genetic tendencies.
Yeah.
That's something we can't really change, obviously.
Yeah.
But what about how a dog is raised and, what it learns along the way?
Oh, these are incredibly important. Huge factors. Early experiences can leave a lasting mark. If a dog learns early in life that acting aggressively is an effective way to make an unwanted interaction stop, say, it growls and the person backs away,
Uh-huh.
that can strongly reinforce the aggressive behavior. It
Yeah.
worked.
Right. It worked for them.
Exactly. Furthermore, the source emphasizes the crucial role of consistent and clear rules and routines, or maybe the lack thereof,
Okay.
both in the overall household environment and specifically in how humans interact with the dog day to day.
So unintentionally sending mixed signals to our dogs could actually contribute to this issue. That's a really insightful point. And you also mentioned that physical health can play a role.
Yes, that's another vital piece of the puzzle, definitely. Underlying medical conditions, especially those that cause pain or discomfort, can significantly increase a dog's irritability and, well, lower their threshold for acting aggressively.
Okay, so there can be a lot of different factors at play here. As owners, how do we even begin to recognize if our dog is starting to show this type of aggression? What are the early signals we should be looking for?
This raises a really important point about being observant, doesn't it? The source stresses the need to look at the dog's history very carefully. Often, and this is key, subtle signs of aggression will precede actual bites.
Subtle signs. Like what?
We're talking about things like a hard, unwavering stare, maybe a low growl, or briefly showing their teeth, baring teeth. These early episodes, even if they seem minor or fleeting at the time, provide crucial information for understanding what's going on and, frankly, what the potential outcome might be down the line.
So we shouldn't just dismiss the seemingly warnings, brush them off.
Absolutely not. No. Think of those as your dog's way of saying, I'm uncomfortable, or I feel threatened.
Yeah.
The text lists a whole range of aggressive behaviors, from the more obvious ones like barking and growling, to more subtle signals such as a slight lifting of the lip or a quick snap, and then escalating to lunging and ultimately biting.
And in what kind of situations might we see these behaviors emerge? What are some common triggers?
The examples provided are quite revealing, actually. Aggression frequently occurs around those valued resources we talked about earlier, their favorite resting spots, their food bowl, their cherished toys.
Okay.
It can also happen during handling, even actions that seem affectionate to us, like petting or simply reaching out to them. Or if they feel possessive of a certain place, for example, lying next to one family member and another person approaches.
It's almost as if they have these invisible personal boundaries that we might be unknowingly stepping over.
Precisely.
Yeah.
Yeah, that's a good way to put it. And the context can go beyond just physical items or locations. It could be when they're denied access to something they want, or when they're resting and don't want to be disturbed, when they perceive a confrontation or punishment, or even during interactions that make them feel anxious or fearful, such as, having their ears cleaned, being groomed, or during bath time, things like that.
And it might not be towards everyone in the house.
No, that's another interesting point. The aggression might not be directed at every single person in the household consistently.
That inconsistency must be incredibly confusing for owners. Really hard to deal with.
It certainly can be, yeah. The source also outlines the different body postures you might observe. There's what's often referred to as confident or maybe assertive aggression,
Okay.
where you might see a dog become very still or stiff, give a hard stare, hold his body upright with ears forward and tail held high, and sometimes they will even move towards the perceived threat.
Right.
But then there's also fear-based aggression, which presents quite differently. You might see tension, a lowered head and body, maybe crouching, backing away, ears pinned back, a tucked tail, looking away, and even licking their lips nervously.
So it's not always about a dog trying to, dominate the situation. Sometimes it's actually coming from a place of fear.
Exactly. That's a critical distinction. Owners might even observe a combination of these postures, which can indicate the dog is feeling conflicted or, unsure about the situation. Some owners describe their dog as having mood swings. And what's important is that they often become quite adept at predicting when an aggressive episode is likely to happen based on subtle cues they've learned to recognize over time.
That ability of owners to sense when something is about to happen suggests they're picking up on very fine details in the dog's behavior, even if they can't always articulate it.
Absolutely. Yes. And the text makes a critical point about how those early, more subtle fear signals might actually become less obvious over time.
How so?
Well, if a dog learns that acting aggressively successfully makes the perceived threat go away, that's a powerful form of learning, negative reinforcement. They might start to give fewer warning signs before escalating to more overt aggression.
Wow, okay. So they learn the warning isn't necessary if the aggression works faster.
Kind of, yeah. You might also notice a more general increase in the dog's overall anxiety in various situations. Interestingly, the source mentions that physical examinations of dogs displaying this type of aggression are typically normal, unremarkable usually.
But you still need to check.
Oh, absolutely. It's still essential to rule out any underlying medical issues as a potential contributing factor. Pain is a big one.
This paints a really intricate picture. Knowing all of this, what are some of the things we should absolutely not do if we're dealing with this kind of aggression? What are the key risk factors, and what's crucial for us as owners to understand?
This is where clear guidance for owners is so vital, really vital. The source specifically cautions against inconsistent or inappropriate use of physical punishment.
Okay, definitely avoid that.
as well as generally inconsistent interactions with the dog overall. It's paramount for owners to understand that the goal of any intervention here is to manage the problem, right?
Right.
To reduce the frequency and intensity of aggressive incidents, not necessarily to achieve a complete cure.
Manage versus cure, that's a very important distinction to make. It sets realistic expectations.
It is. It really does. Successful management hinges on the owner having a good grasp of basic canine social communication and behavior, as well as a realistic understanding of the inherent risks involved when living with a dog that has shown aggression.
Risks, yeah.
And the text presents a difficult but necessary truth. In cases of severe aggression, euthanasia is the only guaranteed way to prevent future injuries.
Yeah, that's a really tough reality to confront.
It is, but it's a critical piece of information for responsible pet ownership in these difficult cases. Furthermore, the source strongly advises against using physical punishment and any training methods that are based on the outdated idea of dominating your dog.
Right, the whole alpha thing.
Exactly. This includes things like forcing a dog onto its back in an alpha roll, using harsh corrections with choke chains or prong collars, and even simply yelling "no" aggressively.
Why are those so bad here?
Because these approaches can actually put people at risk of injury, they can worsen the dog's aggression and underlying anxiety, and they severely damage the trusting relationship you have with your pet. It erodes the bond.
So those old dominance-based training philosophies are not only ineffective, but can actually make the problem much, much worse in these situations.
Precisely. They are counterproductive and potentially dangerous.
Okay, so if euthanasia is not the chosen path, what are the crucial steps to take moving forward? How do we prioritize safety and start to address the aggressive behavior constructively?
Safety has to be the number one priority, it sounds like, always.
Absolutely, non-negotiable. Avoiding all known triggers is the very first step.
All of them.
Yeah, and to do this effectively, you need to really become a detective, Identify those specific triggers by carefully reviewing the history of when and where the aggression has occurred.
Makes sense.
The source provides some practical examples of how to avoid triggers. This might involve limiting the dog's access to certain furniture or areas if aggression has happened there, very carefully managing high-value treats or toys.
How would you manage those?
Perhaps only giving them when the dog is physically separated from family members, like in a crate or another room. And even being cautious with physical interactions, like petting, especially in situations where the dog might resist or has shown aggression before.
So it's really about carefully controlling their environment to minimize the chances of those triggers appearing in the first place.
Exactly. Proactive management. The text also introduces the important idea of empowering the dog by giving it some control to avoid unwanted interactions.
Control. How does that work?
This can be achieved by providing a safe haven, like a comfortable crate or a designated bed, and then using positive reinforcement things the dog loves, like high-value treats, to encourage them to use that space voluntarily.
Making it a good place to be.
Exactly, both for going in and coming out. Again, it's crucial to emphasize that no physical punishment or scolding should ever be used. Ever.
Right.
Tools like head halters, such as a gentle leader, or a properly fitted basket muzzle can be invaluable for safely managing a dog in situations where problems might be anticipated.
Okay.
Using a leash attached to a head halter allows you to gently and safely guide the dog away from a potentially triggering situation without needing to physically handle them directly, which could escalate things.
Those tools might seem like a big step for some owners, but it sounds like they can be really essential for ensuring safety while you're working on the underlying behavioral issues.
They absolutely can be. Safety tools. And speaking of that, what does behavioral therapy typically involve in these cases? What's the approach?
Well, the foundation is always non-confrontational and built on positive reinforcement. The aim is to teach the dog alternative desirable behaviors without creating fear or triggering aggression.
Okay, positive reinforcement.
Yeah. A technique called structured interactions, sometimes referred to as learn to earn, is highly recommended.
Learn to earn.
This involves consistently asking the dog to perform a simple, desired behavior, like sitting, before it receives anything. It values food, a treat, a toy, petting, even just attention.
So they work for the good stuff.
Kind of, yeah. It gives the dog a clear way to gain access to resources by offering a calm behavior. It establishes predictability and structure, helps with impulse control, and reinforces the idea that good things happen when they are calm and polite.
It's about creating a clear and consistent system where good behavior is rewarded. Makes sense.
Precisely.
Hmm.
Owners are also advised to initially ignore the dog if it's trying to solicit attention in other ways, like, nudging or pawing, until it offers that desired behavior, like sitting. Then you immediately use positive reinforcement, whatever motivates your dog, to encourage what we call response substitution,
Response substitution.
which is basically teaching behaviors that are incompatible with the aggressive ones.
Like teaching them to lie down and stay calmly on their mat when they might normally guard their favorite spot on the couch?
Exactly that. Perfect example. Then we move on to desensitization and counterconditioning, or DSCC.
Okay, what does that involve?
This is a gradual process of reducing the dog's negative reactions to situations that have previously triggered aggression by creating positive associations instead. You start by exposing the dog to a very low-intensity version of the trigger,
Very low.
one that doesn't evoke any fear or aggression whatsoever. While doing this, you immediately reward calm, non-fearful behavior with something the dog absolutely loves. High-value treats, usually.
Okay.
Very slowly over time, you gradually increase the intensity of the trigger, always staying below the threshold that would provoke a negative response.
Threshold is key.
Absolutely. This is a slow process. It often takes months and requires very careful observation to understand and respect the dog's comfort level at every step. You might also train specific verbal cues to help manage problem situations, such as teaching go to your bed for a dog that guards resting areas or drop it for dogs that guards toys.
It sounds like a very patient and methodical approach is key. No rushing it.
Patience is paramount, yes.
Are there any other types of interventions that might be considered in some cases beyond behavior mod?
The source briefly mentions surgical options. For instance, castration has been shown to potentially reduce aggression directed towards family members in some male dogs,
Some dogs.
although it's definitely not a guaranteed solution.
Yeah.
There's also a note about potentially delaying the spaying of young female dogs who are showing early signs of what's sometimes called dominance aggression, as it might help to reduce aggression later on, but that's less certain.
Interesting considerations. And what about the use of medications? That's a question many owners understandably have, especially when things feel overwhelming.
It is. And it's really important to understand that there are currently no medications specifically approved or licensed for treating canine aggression in most places.
None approved specifically for aggression.
Right. Any use of medication in these situations is considered off-label, which means owners must be fully informed about the potential risks and side effects, and ideally provide their written consent.
Informed consent. Got it.
Crucially, the text stresses that medication should never be used as a standalone treatment. It must always be combined with a comprehensive behavior modification plan.
Always together.
Always. It's not a magic pill, it's not a quick fix, and owners should not expect medication to guarantee safety. In fact, in households with small children or individuals with disabilities, medication might not even be a suitable option due to the remaining risks.
That's a really important point.
Yeah, and the source also points out that there's a significant placebo effect observed in drug studies for canine behavioral issues.
Oh, interesting.
And overall, research hasn't consistently demonstrated a strong effect of drug treatment on aggression itself. However, in some cases, certain medications like SSRIs, fluoxetine, paroxetine, sertraline, or tricyclic antidepressants like clomipramine might be considered
To do what exactly?
to help manage underlying anxiety or impulsivity and maybe make the dog more receptive to the behavioral therapy, make learning easier.
Okay, so it's more of a supportive role, potentially.
Potentially, yes. But the text lists potential side effects for these medications, which can include things like sedation, increased irritability, GI upset, sometimes paradoxically increased aggression, and loss of appetite with SSRIs.
Right.
And sedation, GI issues, dry mouth, and potential heart-related concerns with TCAs, as well as, again, the possibility of increased aggression.
So medication is a serious consideration with potential downsides, and it's definitely not a substitute for proper training and management.
Exactly. And there are also important contraindications and precautions to be aware of. For example, any psychotropic medication that reduces fear-based inhibitions could, paradoxically, lead to an increase in aggression rather than a decrease because the fear holding it back is lessened.
Wow, okay. That's tricky.
It is. And corticosteroids are specifically not recommended for dogs with food aggression because they can increase appetite, potentially making the guarding behavior worse.
Right.
And it's also vital to be aware of potential drug interactions. particularly when combining certain antidepressants, pain medications, and other substances that can affect serotonin levels, as this can lead to a serious condition called serotonin syndrome.
So any decision about medication needs to be a very careful one, made in close consultation with a veterinarian who really understands behavior meds.
Absolutely, a vet behaviorist is ideal if possible.
What about the long-term outlook for dogs who display this type of aggression? What can people expect?
Well, the source emphasizes the ongoing need for support and follow-up for owners. This isn't usually a fix-it-and-forget-it's situation.
Right. Treatment and the necessary safety protocols are often a lifelong commitment, as aggression can unfortunately recur if preventative strategies aren't consistently maintained.
Lifelong commitment.
Often, yes. Owners need to be aware of the potential long-term consequences, which sadly can include human injuries, the heartbreaking decision of euthanasia, or even having to relinquish the dog to a shelter or rescue, which also carries risks.
Yeah.
While there isn't a cure in the traditional sense, the prognosis is generally more favorable for cases of lower intensity aggression that occur in very predictable situations. But it's heavily reliant on the owner's unwavering commitment to the management plan. Compliance is key.
So ongoing effort, a deep understanding of the dog's specific triggers, and consistent management are really key for both ensuring safety and improving the dog's overall well-being in the long run.
Precisely. That sums it up well.
Okay, let's wrap things up then. What's the most important message you want our listener to take away from this in-depth look at aggression towards familiar people and dogs? I think the most critical takeaway is that managing this type of aggression is it's a complex and multifaceted challenge. It's definitely not about finding a quick fix. It demands a serious commitment to prioritizing safety above all else.
Safety first.
Diligently working to understand the specific triggers for your dog's behavior and consistently applying reward-based behavior modification techniques.
And it really sounds like seeking professional guidance is absolutely essential in these situations. This isn't really a DIY project.
Oh, without a doubt, no. If you are dealing with this, it's crucial to reach out to qualified professionals. That means board-certified veterinary behaviorists or certified professional dog trainers who have specific, verifiable experience in addressing canine aggression.
Right. Get the right help.
They can provide a thorough assessment of your dog's specific situation and help you develop a personalized and effective treatment plan that prioritizes safety.
Okay, so considering the intricate interplay of genetics, environment, and learning that we've discussed today, here's a final thought for you, the listener. What small, consistent adjustments could you start making today to gain a deeper understanding of your dog's behavior and potentially begin to shift it in a positive direction, always keeping the safety of everyone in your household as your absolute top priority?